The blonde surgeon had signed a confidentiality agreement, but Sarah Ortiz never imagined it would involve experimenting on unwilling patients. When she tried to expose the truth, the government made her their next test subject. The recruitment letter arrived on official Department of Defense letterhead requesting doctor. Sarah Ortiz's expertise for a classified medical research project. The offer was prestigious: lead surgical consultant for advanced military medicine at an undisclosed facility, with compensation that would triple her current salary at Metropolitan General. Sarah's piercing blue eyes had scanned the documents with growing excitement. After years of routine surgeries, the opportunity to advance battlefield medicine and save soldiers' lives felt like a calling. The confidentiality requirement seemed standard for military work: no discussion of procedures, patient identities, or research outcomes. She signed without hesitation. The facility, codenamed Project Lazarus, was a sprawling underground complex hidden beneath what appeared to be a modest agricultural research station in rural Virginia. Sarah's blonde hair caught the fluorescent lights as she toured the state-of-the-art surgical suites, impressed by technology that surpassed anything she'd seen in civilian hospitals. Dr. Ortiz, doctor. Marcus Webb, the project director, explained during her orientation, "You'll be working on experimental procedures to enhance combat survival rates. Neural implants, accelerated healing protocols, enhanced cognitive function, cutting-edge medicine that will revolutionize military health care." The patients, he assured her, were volunteers from elite special forces units, soldiers who understood the risks and benefits of participating in advanced medical research. But Sarah's first surgery revealed a truth that shattered her assumptions. Patient designation S-47 was brought into the operating room unconscious, prepped for neural implant surgery. The procedure involved installing an experimental microchip designed to enhance reaction times and tactical decision-making. According to his file, the subject was a decorated Navy SEAL who had volunteered for the enhancement program. But when Sarah began the surgery, her trained eyes noticed inconsistencies that made her stomach turn. The patient's hands were soft, uncalloused, not the hands of a combat soldier. His muscle tone suggested sedentary work rather than military fitness. Most disturbing of all, fresh needle marks along his arms indicated recent and repeated drug administration. "Dr. Webb," Sarah called over the intercom, "this patient's physical condition doesn't match his military background. Has he been medically cleared for—" "Continue the procedure, doctor." "Ortiz," Webb's voice cut through her concerns. "The subject has been thoroughly evaluated." Sarah's blue eyes met those of the surgical nurse assisting her, seeing her own doubts reflected in the woman's expression. But with armed security personnel visible through the observation window, Sarah completed the implant surgery while growing unease gnawed at her conscience. Over the following weeks, similar inconsistencies appeared in every patient Sarah treated. Alleged Marines with no combat scars, supposed Special Forces operators who'd never seen battlefield injuries, Air Force pilots with no signs of G-force conditioning. Each surgery involved experimental procedures that pushed the boundaries of medical ethics: neural modifications, genetic therapies, pharmaceutical trials that would never receive civilian approval. The horrifying truth emerged when Sarah accessed the facility's patient database. Working late one evening, Sarah used her surgical clearance to review patient outcomes, concerned about post-operative recovery rates that seemed unusually poor. What she discovered in the classified files made her blood run cold. The subjects weren't military volunteers, they were civilians, homeless individuals, undocumented immigrants, people with mental illness who had been quietly acquired through a network of corrupt social services and private contractors. The government was using society's most vulnerable populations as test subjects for experimental military medicine. S-47, the Navy SEAL she'd operated on, was actually Robert Martinez, a homeless veteran with PTSD who had been picked up from a shelter and drugged into compliance. The neural implant Sarah had installed was designed not to enhance combat abilities, but to test mind control technology for interrogation purposes. Sarah's hands shook as she read file after file documenting the systematic abuse of human subjects: enhanced healing serums that caused organ failure, cognitive enhancement drugs that triggered permanent brain damage, surgical procedures performed without genuine consent or understanding of consequences. Dr. Marcus Webb appeared behind her as she read, his reflection visible in her computer screen. "Dr. Ortiz," he said calmly, "you've seen classified information beyond your security clearance." Sarah turned to face him, her blue eyes blazing with moral outrage. "These people aren't soldiers. They're victims. What we're doing here is torture disguised as medicine." "What we're doing here," Webb corrected, "is advancing American defense capabilities. Every breakthrough we achieve will save the lives of actual soldiers in future conflicts." "By experimenting on innocent civilians." Webb's expression remained coldly professional. "By using expendable subjects to perfect techniques that will protect valuable military assets. Your surgical skills have been invaluable to this process, Dr. Ortiz. Unfortunately, your newly acquired knowledge makes you a security risk." Sarah realized too late that she had become the experiment's next subject. Security personnel entered the room as Webb continued speaking, their movements coordinated and practiced. Sarah understood that her discovery of Project Lazarus wasn't an accident. It was part of a larger test to study how medical professionals responded to moral compromise under pressure. "You signed the confidentiality agreement, Doctor." "Ortiz," Webb reminded her as restraints were placed on her wrists, "but we need to ensure your silence through more permanent means." The neural implant surgery Sarah had performed dozens of times was about to be performed on her, with modifications designed to suppress memory formation and ensure compliance. The blonde surgeon who had dedicated her life to healing was about to have her mind altered to serve a government that had turned medicine into a weapon. But Dr. Sarah Ortiz, the risk-taking surgeon who had never backed down from a fight, had spent her time reviewing those patient files for more than just research. She had been documenting everything, uploading evidence to secure servers, and preparing for exactly this moment. As the anesthesia mask approached her face, Sarah activated a dead man's switch she'd programmed into her phone. Within hours, encrypted files containing proof of Project Lazarus would be automatically transmitted to investigative journalists, medical ethics boards, and human rights organizations worldwide. The government experiment was about to become the government's worst nightmare, exposed by the surgeon they had tried to silence. The last thing Sarah saw before losing consciousness was the first hint of fear in Dr. Webb's eyes as he realized his perfect secret was no longer secret. Sarah Ortiz had always believed in using her surgical skills to save lives. Now, even as she became a victim of the system she had trusted, her courage was about to save countless others from the horrors hidden beneath American soil. Sarah Ortiz's discovery of Project Lazarus reminds us that the greatest evil often hides behind the banner of patriotism and progress. Her story shows us that true heroism sometimes means sacrificing everything to protect those who have no voice. If Dr. Sarah Ortiz's fight against government corruption moved you, subscribe to the Frontline Voice for more stories of medical professionals standing up to power. Hit like if you believe doctors should never compromise their oath to do no harm. Tell us in the comments, what would you do if you discovered your government was experimenting on innocent people? Share Sarah's story with someone who needs to remember that speaking truth to power always comes with a cost. Until next time, remember that the most important battles for human dignity often happen in the shadows, fought by heroes we may never know.